إله قبل واسع إله قبل واسع إله واحد إله واحد إله كسر إله واسع إله مثل جعلك إله عزيز ومتى ما شاء الله أنت ما شاء الله متقبل يقول إحنا قداش إلهنا في المين إلهنا في المين إلهنا في المين. Alhamdulillah, we are here today at Covington House of Mercy Islamic Cemetery. This place, I think there's a lot of people who the final resting place after they perish due to COVID. Muslims everywhere in the world have been affected by this, but in particular here in the state of Washington, especially King County, Seattle area, this is the resting place for those ones who perish with the COVID-19.
COVID-19, it had devastating impact in our lives. But just how much?
We have some breaking health news as we learn of the very first case of the coronavirus here in the U.S.
We had a bad feeling that this was, not going to be good.
Quite honestly, you're turning on the TV and you're seeing people literally dying in hospital beds.
Because we know who in emergencies, just as a regular day life, gets most impacted. And those are communities of color and poor communities. It was so many people were coming up with flu, and people thought it's a flu. Guess what? It was not really flu, it was a COVID.
COVID itself, what is it? Does it really cause death?
Some important developments in our war against the Chinese virus.
To me, that's not effective leadership.
It was so difficult to see community members losing their loved ones.
Tonight, I am issuing a stay-home order to fight this virus.
When we have to scale down, literally, and get rid of our chairs and the whole dining room, that impacted us.
COVID came, and we were not ready, I will tell you that.
How are we going to pay the bills?
COVID-19 ku witay inay suurtageli weydo inaan hore aan oo furno.
After almost 4 years, I went back to my community to delve into the aftermath and to engage in direct conversations with those who are most affected and those who have directly dealt with the virus. Today, life in Seattle's Somali community has regained vibrancy, a stark contrast to the unsettling times of 2020.
We have some breaking health news as we learn of the very first case of the coronavirus here in the U.S.
The World Health Organization declared COVID-19 a global pandemic.
In late February 2020, the first case of COVID-19 in the United States
here today to give you an update.
Was announced right here in the state of Washington.
From Wuhan, China. Right now, screening is happening.
At this point, folks should go around and do their normal.
Tonight, the governor of Washington declaring a state of emergency after
an announcement that sent shockwaves through our lives.
Also confirms an outbreak at a long-term care facility. 2 people associated with the facility.
This was the onset of an unseen war.
Unfortunately, 1 person passed away overnight. Medically high-risk patient.
The president and his team.
And as you know, we are here today because of this unprecedented outbreak that's facing our community.
Dr. Jeff Duchin is an infectious disease expert and health officer for Public Health Seattle King County. He recounts the moment when they received the devastating news.
We had a bad feeling that this was, not going to be good.
Despite the uncertainty, Public Health, along with city officials, including former Mayor Jenny Durkin, forged a strategy and a plan to mitigate the spread of the virus.
For us to join here. As we move forward, it will be increasingly necessary and important that we are unified in our efforts across cities, across counties, and state government if we want to slow the spread of COVID-19.
Trying to take other measures that hadn't been used in over 100 years in the U.S. since the great pandemic of 1919, the influenza pandemic. things like social distancing, keeping away from other people in the community, closing businesses, restricting activities, closing schools, things like this, which nobody wanted to do. We couldn't believe that we were actually, in a position to have to consider these strategies. It's very stressful because there are bad consequences. I mean, there are unintended and undesirable consequences of all of these things. But that was all we were left with. No drug, no vaccine, deadly virus spreading rapidly. So we were sort of the first community in the country to have to grapple with these questions. And we were building the airplane as we were flying it.
Bruce Harrell, the current mayor of Seattle, although not yet elected at the time, was also shaken by this devastating news.
Quite honestly, you're turning on the TV and you're seeing people literally dying in hospital beds, a lack of capacity, and we still had no vaccination to know about and to think about. And quite frankly, when it started here in Seattle, you didn't know how it could be contracted as well, and there's all kind of fear about, how close you could be to someone. So these were very fearful times. I feared for my wife and my family and for friends and everyone that I knew. I feared for myself. So I think it's important to realize that sort of trauma that a lot of communities went through.
When the pandemic began, we already knew what was going to happen in terms of disproportionate impacts on COVID, both COVID itself and all the other impacts that it might have in terms of disrupting life, and disrupting school, disrupting work, disrupting religious activities, all those kinds of things, because we know who in emergencies, just as a regular day life, gets most impacted. And those are communities of color and poor communities.
The Somali community, too, grappled with fear and uncertainty.
First days COVID, people think it was a flu. What I heard about before the government announced the pandemic and the COVID, it was so many people were coming up with flu, and people thought it's a flu. Guess what? It was not really flu, it was a COVID.
Early on during the pandemic, the biggest challenges we had was fighting misinformation about the pandemic itself, about COVID itself. What is it? Does it really cause death? Is it as rampant as it is globally?
Some important developments in our war against the Chinese virus.
Amidst the chaos, President Trump's divisive remarks exacerbated the situation.
What is your thought on when the President of the United States says that the virus at the time was a hoax and that it was a Chinese virus?
What President Trump did at the time was he took that fear and it easily translated into anger and blame, and it demonstrated to the country what happens as a result. When people are fearful and angry, then they also become vulnerable to different theories of political thought. These people are taking over and these people are bad, and violence occurs as well. To me, that's not effective leadership. And so when he made fun of Asian people and called them names, as he did with even people that were disabled, I think it sort of opened for exposure the soft underbelly of this country. And this country has always had its issues in dealing with race, and dealing with anger, and even dealing with people of color that they see succeeding when some people have fallen through the cracks. So this was awful leadership.
Communities of color, particularly refugees who come from parts whereby whatever government says is the last word, many of them are actually following this very closely. And you'll hear Trump say this, and that's what I believe more than what the doctor is telling.
At a future order as well.
However, Washington State
Now,
leadership,
in approaching
despite
this
such
issue,
challenges,
I think it's important to
acted
know this.
swiftly.
This is an extremely dangerous event that we are facing, but we are not helpless. We have the ability to seize our own destiny and the safety of our loved ones by acting to do what is necessary and effective in reducing the rate of the spread of this epidemic.
Despite the implemented COVID protocols, the cases continued to increase rapidly. The absence of available testing made it impossible to determine who had the virus and who did not.
The problem with that was we didn't have testing available. There were a lot of asymptomatic spread going on, so that we couldn't detect.
The Somali Health Board played a crucial role establishing a COVID task force and disseminating accurate information to combat misinformation.
Any misinformation that could get to the community is something that would have negative repercussions, which we knew would be detrimental to our community. We had very early on, as everyone knows, that Washington State was the very first place, the epicenter of the pandemic. And with that, we went to the mosques, we went to the community centers, we went to the our community, back to our community, relaying this information to them. What does this mean for them? When the government says, quarantine yourself, stay at home, what exactly does that mean?
One heartbreaking challenge faced by the Somali community was the loss of loved ones.
It was so difficult to see community members losing their loved ones. But in the meantime, could not even come along with them to the burial sites because of the impact that it caused, that we could not get close to many people that died. We could not wash them and fulfill the rights as a Muslim. The Muslim rituals could not have been in place during the pandemic.
Imagine the burial itself. You can hardly get people to come over to you and help you. And you would be told, don't touch it, just put it there, put on the dirt and leave it. Our conscience does not allow that as a Muslims, that somebody that we knew we love or loved ones, we cannot simply do that. But trying to prevent that, I am going to be the referee, say, please don't do this, please don't do this, you are not allowed to do this, you are not, well, most of them are understanding, but there are some other people who really don't understand. That is the challenge.
We actually had a Zoom a funeral ceremony for one of our core members because they could not go, family members could not go and participate in the last time that they were able to see their loved ones. But I also want to make sure them to be careful so they don't get sick.
As cases and deaths surged, they stayed to drastic measures.
The Chief Medical.
Governor Inslee announced the first statewide lockdown.
Tonight, I am issuing a stay-home order to fight this virus. This is Washington's stay home, stay healthy order.
Transforming cities into deserted landscapes. The lockdown dealt a severe blow to the Somali community, affecting businesses, community centers, and daily life. Duba restaurant, a beacon of Somali cuisine, serving thousands of customers, was hit hard with the shutdown.
Nobody planned the COVID-19 impact and this virus that really devastated our community, our businesses, our neighborhoods, as a business that relies on human beings and customers. And we were shut down, as you know. The governor proposed that all the restaurants shut down for only to-go orders only. As you know, we are a social community. We like to gather here. Juba is more than a restaurant. It's a community gathering place. This is where people come to get information, to exchange information back home, to find jobs. Whatever you think of, this is what people do. And as such, when we have to scale down, literally, and get rid of our chairs and the whole dining room, that impacted us.
Voices of Tomorrow, the first East African dual-language early learning program in King County, faced its own unique challenges during the lockdown.
What we do is typically serve about 235 children directly every day. COVID came, and we were not ready, I will tell you that. Parents were not ready, our organization was not ready, and we were told to shut down. And at that moment, I remember my partner, Zamzam, and I sitting down and saying, okay, what does this look like? If we shut down, what does that look like? We had at that time almost 65 staff in place, and 50% of them work directly with kids. it's not only children that is being affected, that means also staff is affected.
Somali rideshare drivers, integral to Seattle's transportation network, found themselves without passengers.
It was really a challenge. One day I just visited several places, like make a restaurant in the lot, where the drivers are gathering. And there was a public conversation among the drivers, which was mostly talking about how our income will look like and how are we going to pay the bills.
The SeaTac International Mall, born from the displacement of Somali businesses in SeaTac and Tukwila, faced a construction delay due to COVID.
waxay nagu qaadatay muddo aad u dheer oo aanan markii filaynin customerkii xagaa kasoo barakacayna aan filaynin inay intaa ku qaadanayso waqti badan ay ku qaadatay inaanu meeshii furno wax kasta delay noqdeen maarta caqabado badan oo maarta COVID-19 ku watay inay suurtageli weydo inaan maartay hore aan u furno.
Similarly, the Muslim American Youth Foundation encountered challenges as it was acquired in the midst of the pandemic.
COVID took place when we were trying to acquire this building. And the greatest obstacle that we had was, can we move forward with this facility that we're in? We had so many objections. People saying, listen, the corona is going to happen. This is going to go for a long time. The facilities will come down. We are not able to bring $5 million if things will change. So the biggest challenge that we had to face as a Mace Center was to make the proper decision, which we finally made, to actually take the risk of signing a contract that says $5 million, then you don't even know what comes after that. If things are going to go forever, are we going to be able to provide this money? That was the first challenge that we had to face.
Testing became a crucial tool in identifying and containing the virus. Somali Health Board collaborated with Public Health to set up testing sites in neighborhoods, making testing accessible to all.
We worked very hard with King County Public Health. Initially, early on, we actually contacted Beyonce's foundation all the way in Dallas, Texas, to supply 7 truckloads of PPEs, which were loaded here in Washington State, here in King County, and then ask King County Public Health to create testing sites, real testing sites in Federal Way, in Renton, and Tukwila. That was the only and the first time actually King County Public Health established COVID testing sites in neighborhoods. So we actually played that big role, talking to elected officials, some of our folks we are connected with the public health. In that short period of the weekend, we were able to test 2,500 people in a matter of 3 days. That was an actual change in policy within public health, because initially it was, you got to go to this place to get tested. But if it's easier for families to come downstairs to where they are, whether it's the church or the mosque, then you actually are reducing barriers for these families to get tested. And our staff was actually available in every single site, whether it's the Renton location or the Tukwila location, or within the fire department in the Seattle Rainier Beach area. So our own staff are going there, translating for families who couldn't fill out the form. Because you remember, you really got to go there with your phone, smartphone, scan QR code, and get yourself an appointment so you can get tested. Well, my mother and my grandmother could not do that. They're not possible for them. So our own staff were there translating for them, filling the forms out for them. And even when you get the results, you get a text message and you got to put some information to see what your results are. So our staff was there along the way to make sure families were able to get the tests and then get the type of assistance that they need medically.
Culturally relevant resources were vital in bridging the gap and ensuring minority communities received necessary support.
We developed a community navigator program, and that was in response to community, saying, hey, we need to have community leaders on the front lines, both informing us and then also getting information out to communities. So we established contracts very early in the pandemic. This was in the first months, with dozens of leaders linked to communities. So they would inform us of what was needed and they would help us get the information out. We developed a language access team. We used to just have, working individual programs, sometimes working with an agency to get things translated. We developed the whole team. We were regularly working with over 100 local community translators and reviewers, and we regularly translated into 40 languages.
The development of vaccines marked as a major breakthrough, but faced challenges like misinformation and skepticism.
This country has a long history of, healthcare abuse and particularly racial lines of making sure that some communities, are taken advantage of. We know about the Tuskegee syphilis that were done by the federal government, and let alone local government, right? So the communities already have an ongoing trauma for generations, but it's up to us to make sure that they understand that these vaccines are safe. This is the only tool that we have at this point for us to fight the pandemic.
So for us, what we've learned is the key way to overcome hesitancy is to work with community, to work with organizations like the Somali Health Board, Somali Bridge, anyone who's willing to engage through our Pandemic and Racism Advisory Council. Many partners came together to share information, to share their concerns.
When you have healthcare professionals, you've got doctors, nurses, pharmacists, medical assistants that are coming to them who look like them, who have no other agenda, who resemble them and can connect with them and let them know that I got vaccinated, these vaccines are safe. I got it 3-4 months ago. Then there was less resistance, there was less pushback.
The Somali Health Board and Othello Station Pharmacy administered over 25,000 vaccinations throughout the pandemic and received various recognitions, including one from Governor Jay Inslee of Washington.
The Somali Health Board and different mosques held testing sites and are currently organizing vaccine pop-up sites. And so many from the Muslim community are on the front lines combating COVID and helping those who are sick.
So when the governor takes an opportunity during his annual general address, it meant a lot to us as an organization. And we're grateful that the governor mentioned that, but we still continue to double down and continue to do the work.
Despite the numerous challenges of the pandemic, the resilient Somali community refused to let the virus defeat them. In 2020, Juba restaurant lost half of its revenue due to the lockdown, but did not lay off a single employee.
We did whatever it took for us to, one, to meet the government requirements and to comply with all the health code requirements. Number two, we maintained and kept our employees. We did not lay off our employees. We just cut down the hours, but we did not lay off employees. And as a result, we maintained quality of our food, quality of our service. We were here serving the community during that difficult period of time.
Even more fascinating is that when the state announced the lifting of the lockdown and allowed restaurants to reopen, Juba Restaurant continued to insist on not setting up indoor dining, prioritizing the community's safety for a bit longer.
We chose to not bring back the dining and the chairs and the tables and open the restaurant up. We stayed about 6 months after it was lifted. Other restaurants were opening up their dining and they were just hustling and bustling and doing business like normal. But we chose to be careful and to be safe and not bring back the dining.
Abshir and his team went above and beyond to ensure they continue serving their loyal customers, implementing a foolproof COVID strategy.
We used to have a protocol where we literally had gloves and masks and suits and everything, and we will take the food right on top of the vehicle. The customer is in the car, the windows are up, we don't have to worry about getting sick. Leave the food right on top of the hood or on top of the car, and we'll come back and change everything. We went above and beyond to do that, and customers knew they can rely on us, and we will do that for them. And that's what we maintain throughout this whole pandemic.
Unlike Juba Restaurant, Voices of Tomorrow did not have the luxury of retaining all of their staff due to the lockdown.
We had a lot of staff who worked directly. We had the cook, we had the classroom support, We had the staff that read to the kids. You know, there's a lot of bodies that deal with children. Because the kids were no longer there, we had to lay off those staff and still be able to pay their check up to 3 months. But after that, they had to, we didn't have the financial means to take care of them.
How tough was that?
It was pretty tough. It's tough to have that conversation with staff that I understand that there's no work, because now the resources are being shifted around to do a different scope of work.
In spite of the challenges, Voices of Tomorrow, through strong leadership, devised a strategy to continue serving their community.
We called our funders. We're like, listen, we're shutting down, but we don't want to completely shut down. I know contractually there's obligation that we need to meet, deliverables that we need to meet. What we need you to do is be flexible with the way we deliver services.
The most significant challenges, however, was virtual learning and the lack of proper technology for immigrant parents.
Now, it was not only about serving kids at home. We had to provide technology. Parents did not have tablets, they didn't have computers at home, right? This whole world of you're going virtual, what the heck does that mean, you know? I remember family members saying, and like, what is the kid gonna learn virtually? And us trying to teach them a lot. You could learn a lot. Allow us to be in your space, and that's the other hurdle or challenge we had to go through.
They did not stop there. They set up assistance programs for needy families affected by the pandemic.
The other services that's needed, because now you had a father that was working that's no longer working. You had a mother who was running a daycare, probably now completely shut down. So the financial structure of the home was breaking down. And at that moment, we ran an emergency utility and rental assistance, as well as food program. Families come every month or every other month, however you need it, come pick up your check for rent, come pick up your card for food.
The drivers' union worked tirelessly to ensure that rideshare drivers were back on the road and making a living again.
We hosted the first vaccination clinic in our union office here, while we just partnering with Somali Health Board. I really appreciate for that organization helping a lot to the community, and also Fire Department of Takwila. They just, helping us. We brought them arms, and then they just brought the medication, the vaccination, and then we already distributed, we gave the vaccine over 1,000 drivers in our place. What helps them, the brave that they get to go back to the road, was after we tell them that, oh yeah, you are vaccinated now, so you are likely surviving if the virus hits you. So you can go back and do that. Within other things, we never also, did only that. We also gave them some suppliers. The other things that we did was to communicate, to also publicly in the media, through the media, enforce the companies to provide a sum class that they can divide between the drivers and the customers, which protects the drivers for their safety.
Despite the early challenges, SeaTac International Mall successfully opened its doors, serving as a hub for its community.
runtii waxa weeyaan goobtan is not only Soomaalida kaliya, meeshan waxay mostly hadda cid aan nagu xidhnayno ma jirto. Hadday aan cadaanka tahay, haddii ay tahay any population oo hadda meesha jooga way nagu xidhan yihiin oo way yimaadaan meesha.
A one-stop shop where you can find everything you need.
Tima jariba ku yaala inta timaha loo jarayo, meeshii wax ka cuni lahaayeen baa u diyaara. haddii ciyaalka tuurorinka u keenaan oo after school programka markay keenaan, school programka waa kan ciyaalku intay ugu dhiganayaan meeshay ku jiraan 2 saacadood 3 saacadood ay ugu jiraan. hooyooyinka iyo aabayaashu halkan ay ku qaadanayaan taynkoodii, hadday sheeko tahay, hadday shopping tahay.
What does it mean to having a store now that is open, you know, that people can come and buy things from. What does that mean to your mother, and you think?
It's definitely good because we're within our own community as well, so she can talk to more people and interact and have a community. So it's been really good.
My name is Global Cuts, so I like to touch every culture. Everybody's welcome here. You know, this is a place, a safe zone to be yourself. It's nice to be a part of this community. You know, you get to learn from different people, share different cultures, you know, just learn different stories. But, you know, it's a beautiful journey. You know, you meet new people every day. You know, the support here is phenomenal. You know.
The Muslim American Youth Foundation successfully opened its doors after a challenging year.
Definitely, it was exciting. It was hard to believe, even for myself. Facility where you have a two basketball courts, you have swimming pool, sauna, jacuzzi, steam room. Even though there was so much excitement for the community, the social distancing and restrictions that were out there had limited us because we really wanted to prioritize the lives of our community.
A place that kept the community together during the most difficult times, the Maeve Center, as it's known to the community, is now a hub for the youth across King County. The Somali community in Seattle, along with government and health officials, worked together and came out of the pandemic successfully, serving as an example to many other states. But many could argue we could have done better.
The federal government were not prepared, the state government were not prepared, the local government were not prepared. Number one, the facility, if 5,000 people have COVID today, they have no space. Imagine, I was a witness that when the stadium, T-Mobile Stadium, was changed to the hospital, people to treat it. Those are kind of things. The medication, they have to ration it because they didn't have enough machines, people to get support with their breathings.
This pandemic has taught us a couple things. One is we actually live in a system, a healthcare system that's broken, a healthcare system that needs major revisions, a healthcare system that disproportionately negatively impacts communities of color, a healthcare system that still up to now, that nothing is being done, that a lot of it is just putting a Band-Aid on a huge wound, saying, okay, let's just stop the bleeding and see what happens down the road. We were faced with one of the ultimate tests globally, and one of the richest countries in the world, whereby its own citizens could not, appropriately be taken care of, disproportionately died, disproportionately impacted, spent years in the hospital for some folks.
What do you want to say to those people who say, we could have done better? Public health could have done better.
Yeah, I think, I agree. I think we could have done better. We worked extremely hard. We were working 7 days a week, but always working hard doesn't mean always, we're trying to be smart. But I think there are always things that we could have done better, and we could have, asked more questions, and we could have been even more thoughtful, or we could have slowed down. I think there are a number of things that we did really well, like within vaccination, for example, that we were able to work with very specific teams and community groups and different zip codes even throughout the county to get very high, some of the highest vaccination rates by geography and by race, and compared to the rest of the country and other metro areas.
Absolutely, our connections with the Somali community, the Somali Health Board, Somali Bridge, and other organizations in the community were essential in helping decrease the misery, the number of cases, hospitalizations, and deaths that could have occurred.
When you look at the number of both vaccinations and the number of COVID tests that were dispensed through those organizations, that was phenomenal work.
The Somali community is now in a much better situation than when COVID hit, but the effects of COVID still linger, impacting mental health and the availability of resources in the community.
Pandemic is gone, but the impact of the pandemic has not gone. It is still there. It's still there. As a community, it affected us financially, mentally. It's still there. It's not gone. And people think the epidemic is gone. It is gone, but the effect of it is not going to be gone quickly. And because of that, I wanted to shout out to everybody that's able to support our community, the community, the like of our community, the underserved community, the immigrant community, the black community, the African community that have so many young people that are going through still mental challenge, that are going through mental challenges, family, challenge that they're going through.
I think what COVID was a very short term, but as a community, as a state, there's always families struggling. There's always families that are, the income bracket never changes. The poverty level is perpetuated systematically. And we really need to look at our systems. What systems is in place that are perpetuating this cycle, and how do we remove that? And what does a collective, co-creative process look like? Because I think the solution comes from the community, and oftentimes it's not the community that's making the decisions.
We should not sit back. Now the pandemic has gone and think like when everything is great. It's actually not. We still continue to have the same issues. There are many who don't have healthcare coverage, they don't have dental coverage, they don't have vision coverage, and continue to have the same cycle of poor health outcomes as a community. But for us as well, despite having to do all of that work as an organization, we had to lay off 4 or 5 of our own staff after the pandemic, because now that the vents, the COVID vaccines and all of that is gone, then the funding pool that used to come and support that work is gone as well. So being able to continue that work in itself, whereby we can say we need to continue to have education sessions, talk about COVID and its still impact, talk about vaccinations in general, the hesitancy with vaccines in general, that team now is sort of like dismantled because we don't have the funding available to continue to do that work.
waxaanu dareemaynaa inaan haddana community aan nahay ama moolkii nahay ama aanan helin support badan xagga maaragtay haday dawladda tahay haday maaragtay aanan support badan helin hadda kirooyinka dadka laga caawinayo weli ma aanan helin fursadahaas ma aanan u helin anagu kirana laga caawiyo in dadka meesha degan kira laga caawiyo oo dhowr koob loo hadaa laga bixiyo maaragtay waan ku darsan lahaa codsigayga in haddii ay suurtagal tahay in arrimahaas oo ay noo soo maartay aan ka helo fursado xagga dawladda.
COVID might be in a more manageable state now as an endemic, but we're still not out of the woods.
COVID is still here. There are people who are still testing positive. We're not out of the woods completely 100%. And we also need to be very vigilant in that, thinking that still there could be another variant that can possibly be from somewhere else around the world and continue to do the same thing we've experienced before.
3 key, things I think the Somali community and all of us need to keep in mind. Vaccination, indoor air quality. It's still good to avoid COVID if you can, by avoiding high-risk situations and taking steps to protect yourself in high-risk settings, and staying tuned, because we don't, we're going to learn more, and we'll have more information over time about how to do things better.
So proud of the Somali community, and the Somali community has to deal with a lot of the issues that other groups from other countries have to deal with, and that is sometimes the negative imaging, the stereotypes that people suffer. And how you overcome that is doing the kind of work you're doing right now. Let people say, I'm Somali American, I'm Somali, I prize my culture, I love this country as well, I'm going to contribute to this country. It becomes beautiful.
With COVID, the world confronted an unimaginable crisis. The Somali community, like many others, was tested. Yet, they emerged with their spirit unbroken, stronger and more united. Their journey from loss to resurgence, from despair to determination, is a testament to the resilience of a community that refused to be defeated by a silent foe.
حسيلي